Hair transplant to fix an uneven hairline. Most hair transplants we perform are for patients who experience alopecia or hair loss. However, the second most common reason patients seek hair transplants is for hairline surgery. The way hairline surgery is performed varies greatly from patient to patient, as it depends on their specific needs and aesthetic goals. For some patients, the main concern is an asymmetric hairline, where one side sits higher or lower than the other. Others may have a widow's peak without experiencing significant hair loss. In other cases, the hairline may naturally sit too far back, which makes the forehead appear relatively wider. This is a common concern for those who feel that a high hairline impacts their overall facial harmony. Some individuals may have other unique issues with their hairlines, such as irregularities in the hairline shape or thinning in specific areas. In fact, a large number of patients come to us specifically wanting to correct an uneven or asymmetric hairline. One of the advantages of this type of surgery is that it typically requires fewer hair follicles than a traditional hair transplant for hair loss.
Before we continue, please visit RuthHairTransplant.com for more information.
To fix an asymmetric hairline, we usually only need to adjust one side of the hairline to match the other side. This results in a more balanced and symmetrical appearance. On average, about 2,000 hair follicles are enough for this kind of procedure. This is significantly fewer than the number needed for a full hair restoration, where more extensive coverage is required. The process is quite similar to other hair transplant surgeries in that we harvest hair from the donor area, which is typically the back of the head. Since this procedure is not meant to address extensive hair loss but rather focuses on hairline line correction, it is generally a less complicated surgery. Because of the localized nature of the correction, the surgery tends to be quicker, less invasive, and often leads to highly satisfying results. If you are concerned about an asymmetric or uneven hairline, a hair transplant can be a highly effective solution to balance both sides of your hairline and enhance facial symmetry. With minimal hair grafts required, this type of procedure is ideal for patients looking for subtle yet noticeable improvements to their appearance.